Hello, welcome to Nursing with Professor B. Do you have a lot of neck pain? Like, this region here? Or do you know you have herniated discs or arthritis in your spine, which is sometimes called cervical spondylosis? If so, I may have something that may help you. Make sure that you continue watching until the end. But first, make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go! In this video, I will be discussing if you have a lot of neck pain and even maybe some like shoulder trap pain here. As always, I always say this is not medical advice. This video is purely for educational purposes. Before you do anything, I always recommend that you talk to your healthcare provider. I cannot be held accountable for any kind of thing you choose to do or do not do, or any injury that may come from this. So as always talk to your healthcare provider first. I don't really like to talk about all the pain that I've experienced. Like, I really don't like to talk about all the physical conditions that have happened to me in my life, but I do them but I'm doing these videos because there are a lot of people that live with chronic pain. And if I can help even one person, then it will be worth it. What are some causes of neck pain, and then who is a candidate for what I'm going to recommend to you? Well, causes of neck pain can be herniated disc, facet pain, which a lot of times is due to cervical spondylosis or degeneration of the spine. So if you have herniated discs, bone spurs, degeneration in your neck, and again, I'm doing this for neck pain, cervical pain versus lumbar low back pain. This treatment works better for neck pain. If you have facet disease, I will go over what a facet is, pinched nerves, or if you feel like you have radiating pain. If you have pinched nerves, like here sometimes, that can cause you to have like numbness and tingling in your extremities, in your arms, numbness sensation. So herniated discs is this picture that you're seeing here, and a lot of times it can actually pinch a nerve. And if you have herniated discs, it causes the muscles around that area to spasm because your body is always in self-protection mode. So because it notices some kind of instability, it tenses up, and all of a sudden I used to have chronic excruciating pain here. It was all on my right side. So in my neck and in the trapezius, right? It was excruciating. And I had tried everything. I tried acupuncture, I tried chiropractor. Massages would help, but only temporarily. Nothing was really helping me, to the point where I was desperate, and I started working for a pain doctor, and that's where I learned about radiofrequency ablation. And basically radiofrequency ablation is where they go into the nerves, the sensory nerves on the outside of your spine, and they burn those nerves so that those nerves don't send pain signals to your brain anymore. So I was willing to go through whatever it took because I was in so much pain. I did not want to take any medication. I did not want to take any narcotics or opioids. I'm very sensitive to that. I didn't want to do that. So I thought that this pain here was because I do grind my teeth a lot at night. I had braces and I don't think my teeth aligned well. And I also had a lot of jaw pain. So I have two things going on this side. I'll get to that in just a minute. But I had like the TMJ disorder, and on top of that, I had pain. So I thought it was all from the jaw, from me grinding, that it was like going down here. But I ended up getting in a car accident. Someone hit me from behind, and I went and I saw a chiropractor. They ordered an MRI on me, and lo and behold, I had disc herniations. I had herniations in C3, C4, C5, C6, right? So most of my cervical spine had disc herniations. And then when I was seeing patients in the clinic, when I used to work for this pain doctor, I was noticing that the same kind of pain that I felt is what they were describing to me. So that's where I realized, this isn't all coming from my jaw. This pain is coming from probably my cervical spine. I had no idea. I had so many herniations in my neck. I don't really know how it got that bad. So I think the car accident made it worse, but I probably think something was going on before. These are the facets in your spine. If these are irritated, then the facet joints become inflamed and they may cause pain, soreness, and stiffness. And this is the area, depending on which side you have herniations, where you can feel your pain. And this is exactly where I was feeling my pain. This was my pain zone right here, all of this area here. After working, when I would be there and I would be working at the pain doctor's office and I would have my arm up because I'm moving the mouse, I would be in so much pain in this area. It was awful. I felt like Van Gogh when he had so much pain in his ear that he just wanted to cut it off. I just wanted to slice all these muscles off because they were always so tight and in so much pain. It was constant, dull ache and pain. This is my dermatome man, right? A lot of us in the medical profession know Mr. Dermatome Man. If you have herniated discs, dermatomes basically means this is where the nerve pathways goes, right? The cervical discs, the cervical spine affects all of these upper extremities. So if you have any kind of nerve impingement, you're going to feel numbness, tingling, either here C6, right, down the thumb. C7 is the middle finger here, and C5 is this area, C6 is that area, right? So my pain doctor was the first one to recommend cervical traction. He's like, have you tried cervical traction? And I was just like, what? And chiropractors call it decompression. And basically what cervical traction is it works by stretching the spinal vertebrae and muscles to relieve pressure and pain. So here are some benefits to cervical traction. Cervical traction helps to relax the muscles, and this can significantly relieve pain and stiffness, but also increase flexibility in the neck. It can alleviate pain from joints, sprains, and it's also used to help treat neck injuries and pinched nerves. So cervical traction works by stretching the spinal vertebrae and the muscles to relieve pressure and pain. Force or tension is used to stretch or pull the head away from the neck, and creating the space between the vertebrae relieves compression and allows the muscles to relax. And what this does is that it lengthens and stretches the muscles and joints around the neck. One study analyzed the effectiveness of cervical traction in relieving neck pain, and they found that the treatment significantly reduced neck pain immediately following treatment, and pain scores were also reduced in the follow-up period. Now, mechanical traction was more effective than exercising alone or exercising in addition to using over-the-door traction. And then the other thing that I wanted to mention that I read is the cervical traction devices that you use while you are sitting are not as effective. In fact, they can actually aggravate the situation. Why? Because you still have gravity weighing you down, and then you have something around your neck. So I highly, highly recommend that if you're going to get a traction device, it's a traction device where you are laying down, gravity is released. That's why this cervical traction device is so effective, because you're laying on the floor and you're relaxing your muscles. But when you're uptight and then you're inflating a cervical traction device around here while you're sitting, I do not recommend those. Studies have found that doesn't work as well. So that's why specifically I thought this traction device was so phenomenal. And like I said, I'm not getting any kind of payment or compensation for this. This is just me trying to help you. It's something that really, really helped me, and it's helped my pain considerably. I did read some studies where by doing traction, the herniation has been reduced, but also symptoms improve significantly in individuals. So I was skeptical. I was like, I've tried so many things. I really doubt. And I had spent so much money. I was like, I really doubt that a traction machine will work. Where do I get a traction machine? He had recommended it, but I didn't know what kind of cervical traction or where I would go for it. So I was kind of up in the air. I didn't know what to do. Because I was in so much pain, I went to a pain doctor. I looked up a pain doctor that was under my insurance plan. I went to him and I was like, look, I'm having so much pain. What can I do? He wanted to do a steroid injection in my spine. I didn't want to do that. I was like, I'm willing to do trigger point injections. So they had to clear it with the insurance. So I had tried trigger point injections too before. They didn't really help, but I wanted to try everything before someone going in my spine, because I'm just going in your spine for me is a big deal. Like, what if they mess up? So he also was like, have you tried cervical traction? And I was like, no. And then he actually recommended a specific device for me, which is what I had been missing. I didn't know what to do, where to go, what device to try. So he wrote it down for me, and then I looked it up online. So I'm going to show you the device that he recommended for me. But before I show you, people that cannot do cervical traction is someone that has rheumatoid arthritis, screws in your neck. So you've had surgery, right? You don't want to mess up any kind of surgery that you've already had done in your neck area. If you have a tumor in the area, a bone infection, blockage with vertebral or carotid arteries, osteoporosis, cervical instability, or spinal hypermobility. A lot of conditions like Down syndrome, they may have axial instability in the neck. So hypermobility sometimes happens in Marfan syndrome. So always, always, always talk to your healthcare provider. Tell them, can I try this for my neck pain? If they say yes, then you can proceed. The device that was recommended to me was specifically the Saunders cervical traction device. It is pricey. It costs $319. So that was I was like, should I buy it? Should I try it? This is the device. It you have to pump it up kind of like a like a bike pump. You lay down on the floor and you pump up the device. There is a video. Let me play this video for you. So I'm speeding the video up. But it comes in a bag and you lay it down on the floor. And what I do is I prop my feet up in a chair. So I'll put a chair like next to me, and then I prop my feet up so my feet are almost like at a 90-degree angle like this. You can adjust the height of it. I leave mine at the lowest setting. You lay down, you strap yourself in. You do want to make sure that you're like facing straight. I do this for about 20 minutes a day. When I first started, I did this every single day for 20 minutes. Now that I'm doing so much better, I do it maybe every other day, or, 2 days will go by and then I'll do it again. I'll probably do it today. I do start to notice when I haven't done it for a while, like this will start almost to come back, but this has been amazing. This has changed my life. You want to relax, okay? If you are holding your neck too tight when you do this, you will end up doing more damage. The first few times that I did it, I did get muscle spasms. It's normal. So for the first week, I actually was in more pain. And I was like thinking of quitting, but I'm glad that I persisted because this again has changed my life. There is no massage, no chiropractor, no acupuncture that has made me feel better than this device. So as you can see there, it stretches. And then what I do is I will hold it, and then just how he released it, I will do intermittent like cervical traction. You can hold it for the full 20 minutes, or you can pump it up, release, pump it up, release. But I prefer to do intermittent traction. So again, this one was the one that was recommended to me by this pain doctor. It's Saunders cervical traction. It costs $319. It has free shipping. By the way, I'm not sponsored whatsoever. This is just me trying to help you to get out of pain. I'm not getting any kind of like affiliate payment or anything like that. Amazon, if you type this in, this one comes up. They do have the Saunders here, but it's a lot more expensive. So you see $349 plus $30 shipping. So don't get it on Amazon. This one's $653. And they have this one on Amazon, $379. So it's still more expensive than the $319. This is the company that I bought it from, and it worked great. Pro Therapy Supplies. This is the one that's on Amazon. It's very similar. Again, I haven't tried it, but it's more expensive. So why would you go with Amazon at this point? And like I said, this is a different version than the one that the medical doctor recommended to me, so I specifically wanted to go buy. But I almost bought this one thinking this was the Saunders cervical traction, because when I typed it in, this is what came up. So when I Googled it, that's where I was like, oh wait, I almost bought the wrong one. So I did buy from this company specifically. I was very happy that my order came on time. It did not take long. This has been a game changer for me. I am in a lot less pain every day. I can now work full. My biggest fear was always like, what if I'm not able to work at some point in my life? Like, what if I want to be able to work? I hate just like not being able to be a productive member of society. So now I can work at this point right now. I'm working 10-hour days. And I mean, even with the mouse constantly, this is still pretty good. When you first start out, you may have to do it more consistently. You may have to do it every day for a few weeks. And then after that, when your spine gets a little bit healthier, then you can kind of cut back on it a little bit. So this has been a game changer for me. It has improved my quality of life tremendously. I'm not in chronic excruciating pain. Once this quarantine is lifted, will I still get massages? Of course, I think massages will still help. In the past, I was constantly having to massage myself. I would joke around with my boyfriend. I was like, if I had a perfume after me, if I was a celebrity and I had a perfume, my perfume would be Bengay or Biofreeze, because if I did not have Biofreeze here, I was always like in pain. It was not pleasant. So I'm very happy that I finally found something that gives me relief and that is drug-free, side effect-free. So I truly, truly hope that it works for you. If you try it and it makes a difference, leave it in the comment below. If it doesn't work, I'm sorry. I wish it had. There are other alternatives that you can try. You can try the radiofrequency ablation if for your neck pain. You could try. There are natural drugs that medical doctors are experimenting with. This doctor that I went to, he was a medical doctor, and he actually was going to inject Traumil, or in Spanish Traumil, in my spine, which is a natural anti-inflammatory, and it's spelled Traumeel. They sometimes will do PRP in the spine. They will do stem cells in the spine. So there's more aggressive alternative treatments, but I didn't want to start there. I wanted to start with the least invasive, and I will continue to do traction until it no longer works. And I really hope it works. God forbid if it stops working someday, then I probably will look into the stem cells or the platelet-rich plasma. But until that point, I will continue to do this because it's worked well thus far. All right. Thank you for watching. Make sure you hit the like button. Make sure that you subscribe, and make sure you turn on that notification bell.